So I had a total knee replacement about 10 years ago. And about 2 or 3 years in, I started realizing that the flexion was starting to diminish. Um, so I went to a couple doctors in where I live, and the first one basically just told me I needed to go back to physical therapy. And I was like, okay. So I did that for a while. That didn't help. The second one didn't do revisions, so they just kind of looked at me and gave me some pain medicine and sent me on my way. And then the third one, which was in March, um, told me that he believed that it was loose, and it may or may not be loose, the components. And regardless whether it was loose or not, he would go in and he would replace it. And I was like, no, I'm not going to replace it if it's not loose. And then he also told me that we don't make any money doing revisions. So that guy was totally out. So I was researching and I found Dr. Stone. I came out here in October and we did an evaluation, and he told me what he felt was wrong. And at that point, it made sense. Like, it fit. All the other diagnosis didn't fit the way it felt. So when he diagnosed it and told me that he felt like something was catching, that made sense to me because it wasn't unstable, so didn't feel loose to me. So some of those kind of things just didn't make sense. So I came back here in January and we were going to replace the spacer because he felt like that's what was hitting. And then he had some other possibilities that he might have to do, but we just replaced the spacer. And the most I was getting prior to the surgery was 85 degrees. And today, my first day after surgery is 91 degrees. So I'm a very happy camper.